I want to talk about the program now specifically. How did this project come about? And obviously it's a very complex problem, many, many different factors. How did it start where you were able to conceptualize it, but then actually put something together that you could execute?
Yeah, well, that is a big question, and it perhaps would be better answered by one of our co-medical directors who were there from the very beginning. But I will say that it was not coincidental that the ACEs Echo launched it was the fall of 2022, and that was when the Department of Health released the advisory that New Mexico had the highest ACEs score in the nation. And the idea really was about, part of it is just what Echo does generally, which is how can we make sure that we're resolving that dilemma of translational science where really good research and best practices tends to stay holed up in the university for around 20 years on average, I think. How do we get that out to the communities where it can do good for our patients as quickly as possible? And then another part of it that I think is a little subtler is about creating a community of practice between the many providers and educators in New Mexico who are working with children and who are in a really great position to be able to screen and intervene for ACEs, because it is hard work and it's hard to know what information is best and where to find the best practices. And by consolidating that and having a lot of discussions around it, which is part of the Echo model, is making sure that it's very interactive. We all get to know each other and we all get to know more about how this is showing up in regional contexts. So it's not just about what we know from academic learning about ACEs, it's also about how does this present in these particular areas, in these particular communities. So there's that sort of bi-directional exchange of information.
Where does your specific expertise as a clinical psychologist come in with this program?
As a clinical psychologist, my specialization is with substance use disorders, and that's really one of the hallmarks of ACEs. It's one of the most likely outcomes of higher ACEs. And so a big part of what I'm always hoping to do with our echoes is to introduce into the conversation some anti-stigma messages around how to work with communities with substance use disorders, and also particularly in this context to emphasize that relationship between ACEs and substance use disorders, because I think it's an important part of helping our providers, our educators, our population in general to have a more empathic perspective towards people who are struggling with this illness.
What have the results been so far? Is there evidence to show that this project is working?
Yes, yeah, we've had really great results. Just being a more qualitative person, I always orient towards the sort of quotes that we get in the feedback. So I really appreciate hearing so much from our providers about them feeling much more confident about understanding how to incorporate, for example, screening for ACEs or how to do differential diagnosis, including ACEs. And also just them rethinking structurally how they can incorporate this into their system. So we have a lot of administrators, both on the educational and the healthcare side who attend and who say, I realized through this that there was this, missing link in our procedural workflow. Now we can incorporate a screening for ACEs and we have somebody to follow up on it, et cetera. But overall, we do see the needle move in terms of people specifically rating their sense of confidence and their willingness to use interventions related to ACEs. And those are the metrics that tend to be most important for us because we want to make sure that all of this is actionable.
Okay. Now, you mentioned it briefly there, but can you think of a specific patient's experience, without identifying them obviously, that either stuck with you or worked out in a way that this program was designed?
Oh, yeah, a lot. One that we've discussed before because it was really memorable for all involved, where there was a patient who was, barely adolescent, around 14 years old, and who had a child. And she just is one of these cases that we often see on this echo, where they sort of slip between these bureaucratic cracks where she was too young for a women's shelter, but she was too old for the traditional services for a child, and because she had a baby herself, she wasn't able to access those. And so even though it wasn't that we had a ready answer right there during the presentation, this was one of those cases where everybody, not just the HUM team, but the participants too, really rallied and emailed their contacts and figured out resources that were specific to this patient to make sure that she was going to be taken care of, even though she didn't fit into any of these neat boxes where her provider would be able to send her, oh, it makes sense to put you here. And in that way, that's a case where we're not just disrupting the cycle of ACEs for her, we're also potentially helping her to disrupt that cycle of transmission to her child, who now presumably is going to be able to be raised in a much more stable environment than she otherwise would have.
For somebody watching who might have heard the explanation of what these ACEs are, and they look back at their childhood and think, man, maybe I fall into this, and what advice would you give them to identify what's going on within themselves so that they can raise their child better than they maybe would have otherwise?
Yeah, I really appreciate this question. One of the things that's most inspiring about working with this population is how hard parents work to make the lives of their children better than their own were. So I really see parents very motivated to do this. I will say there's a great resource from Dr. Nadine Burke-Harris, who the former Surgeon General of California, who popularized ACEs screening. So there's a website called Number Story where there's a lot of concrete resources that parents can look at that have to do with clinical interventions and broader lifestyle interventions. But the bigger idea here is really about how parents can, it sounds a little bit corny, but how parents can heal themselves in order to ensure that their children don't need to heal from their own experiences. So a lot of it has to do with the ACEs. I think are very useful in terms of putting into context for people. This was a real thing that happened to me, and it makes sense that I've really suffered from it, because so many people come from cultures of stoicism or other contexts where they've been told that it's not okay to feel badly about what happened to you. So I think the validation is the first part, and that's part of just using the instrument. And then being able to talk it through, ideally with a provider, but it could also be with a trusted friend or a family member, and making sense of what those ACEs have meant for you and how you want to change your own story, because the intentionality is an important part of it. Simply understanding how it's impacted our physiology so that we can choose what's going to be right for me to feel more calm, more at ease. How can I start to bring down my own prolonged stress response so that my child gets to engage with a caregiver who's relaxed and at ease and really just enjoying and being present with them.
What is the project's ultimate goal? Is there a timeline for hitting a specific data marker, or is this more of just a consistent, concerted effort to address these issues and bring down those totals?
Yeah, that's a great question. If there is a really concrete answer to it, I don't know that. It might be out of my pay grade. What I would say is we sure would love to think that in just a few years, all the providers and educators in New Mexico will have all of the tools they need, and that we'll have worked ourselves out of a job. From what we've seen so far, there's just a real hunger for this material, so I don't see that happening, in the immediate future. But part of it too is that our curriculum is designed to be layered, so we don't do the same curriculum every year. We really expand and add and adjust based on what feedback we've gotten and what we're seeing in the current, climate in terms of what's going to be most relevant for providers. So the grim part of it is that there's always more to do around ACEs, but I think the upside is we have such an extraordinary community of providers and educators in New Mexico that are very ready and very willing to learn, and they seem to have quite an appetite for the material we have to offer.
Great. Well, Dr. Evelyn Plum, thank you so much for being here on New Mexico in Focus.
Thank you, Lou.